Hi, my name is Kristi Chapman and I'm an occupational therapist and certified hand therapist. We are celebrating OT month today with OakBend by talking about what is trigger finger.
So what is trigger finger?
Trigger finger is often called stenosing tenosynovitis. It involves the tendons and the pulleys of your hand, of your finger, and your thumb, okay? It can occur in any of the fingers or the thumb. Pulleys are fibrous rings of tissue that surround the tendon, that keep the tendon next to the bone, kind of like the eye hooks of the fishing pole do to keep the line against the pole when you catch the fish. So if you didn't have pulleys in your finger, when you make a fist, your tendon would bowstring out of your finger.
What causes trigger finger?
The causes are not always known. Sometimes the causes can be from an underlying medical condition that you have, such as gout or arthritis, osteoarthritis or rheumatoid arthritis, or even diabetes. Sometimes it can be caused from over gripping. Usually that's really the cause, is doing too much gripping. Sometimes it can be related to getting over an injury, such as a distal radius fracture, or something that causes a lot of swelling in your hand, such as having a recent surgery to your hand, like a carpal tunnel release. You have a lot of residual swelling, and then that can sometimes target the tendons.
What are the signs and symptoms?
The signs and symptoms of trigger finger are, first and foremost, is pain at the base of your finger or at your thumb. It's also sometimes very palpable, tender to touch right there in that area. You can sometimes feel a nodule on your tendon in your hand. It can be the symptoms is when you make a fist, your finger will click or snap or catch, or sometimes it will fully lock down, and then you have to unlock your finger. Every time you do that, you're causing more inflammation to your finger, to your tendon, and it's a vicious cycle and it won't go away.
What can you do if you have trigger finger?
It's a good question. So the first thing that I would do would be to apply some heat to your finger, to your hand, and for about 5 to 10 minutes, and then gently stretch that tissue back and gently roll, stroke and massage, do some soft tissue mobilization over that area to try to get it to release and to calm down, okay? Stop doing the things that are provoking your symptoms. If every time you close your hand, it's going to lock and trigger, don't fully close your hand. You need to kind of have a lighter grasp on things. Avoid firm grasping and avoid full fisting. You want to stick with hooks only. Then put lots of ice on your hand. If that doesn't make it go away, then you can go to your doctor. Your doctor may give you medication to help eliminate the inflammation in your hand, and they may give you a cortisone injection at the base of your finger over the painful area. That usually helps a lot. And then he can send you to therapy where I can help fabricate custom orthosis such as this that maybe you wear at night, that can keep you from fully making a fist at night, that's also inflaming the finger. We teach you how to do your exercises, teach you how to treat your symptoms with modalities and other techniques, help you get the inflammation out of the tendon, and then just teach you how to just keep this from coming back. Thank you so much for celebrating Occupational Therapy Month with OakBend.